Welcome everyone, and thank you for joining us for our webinar, Inflammation and Allergies, presented by Dr. Pamela Overjay. My name is Dr. Paul Herkel. I'm Aor's medical director, and I will be your host and moderator for today's presentation. Before we get started, as usual, I would like to go over a few housekeeping items. There will be a Q&A session at the end of the presentation, but if you'd like to ask a question, you can do so throughout the presentation by typing it into the question box in the control panel on the right side of your screen. Please note that this presentation is being recorded for future distribution. The content of this webinar has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. And any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or host are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Okay, so let's meet today's presenter, Dr. Pamela Overjay. She's a senior research scientist and head of regulatory affairs at Aor. Dr. Overjay completed her postdoctoral work in biochemistry at the University of Windsor, where she worked on a really neat novel dandelion extract as a potential natural cancer therapy option. This was actually featured in the CBC and something that got national coverage. She has applied her strong background in this research in cancer and molecular biology to develop safe and effective natural health products. Her work at Aor includes formulations, key regulatory applications, and a lead researcher for Aor's many research projects. She's also the recipient of the 2015 postdoctoral MyTax Award for outstanding innovation during her postdoc work in collaboration with her work at Aor. So she's a star at Aor, and we're really excited to have her join us for this webinar. So without further ado, I'm going to turn it over to Dr. Pamela. Welcome, and thank you so much for joining us today, Pamela.
Thank you, Dr. Herkel. And thank you everyone for making time out of your busy schedule to join us on this webinar. I will just go over the outline of the presentation for today. Today I will be discussing about inflammation and the role of the immune system and the microbiome in inflammatory responses and allergies, and what your options are for dealing with a lot of the allergies that can be found today, I guess. So I guess the first question is, what is inflammation? This is more common than you will think, and it can be your best friend in moments of injury because it acts as a defense mechanism when there is damage to living tissues or cells. And the purpose of the inflammatory response is to localize and eliminate an offending agent and allow the body to heal. And it can be stimulated by various agents, physical, chemical, inappropriate immunological responses like allergies and tissue death. It's generally characterized by redness, which is caused by dilation of blood vessels in the area of injury. It's also characterized by heat. When those blood vessels dilate, there is blood flow to the area of injury, and that increases the heat around the site of injury. The blood flow is also bringing chemical mediators of inflammation, and so that could lead to some fever and swelling, and the swelling can also cause distortion of tissues, which ends up being experienced as pain. Extended inflammation and pain can lead to loss of function. So an acute response to an offending agent will cause an acute inflammatory response, which is rapid, and it tends to last a few days to a week, and it's generally resolved within that time period. However, prolonged exposure to an inflammatory agent can cause chronic inflammation, which again is still caused by an infection or trauma, but it has a more slow onset and could last for months to years. The problem with chronic inflammation is that it tends to play a role in major health conditions that we're currently dealing with. So resolution of acute inflammation is always a better response. Okay, I think my slide is stuck. The process of inflammation is complex. It is a network of inflammatory mediators, various cells, and multiple signaling pathways. And it should be noted that the inflammatory response is directly related to the offending stimuli. And so there are multiple pathways. I can find multiple pictures on the internet of different inflammatory response cascades. I just picked one. And all the references for everything that I'll be discussing today can be found at the end of my presentation. So you don't have to you don't have to memorize the slide, I guess. But the process of inflammation consists of changes in blood flow and increase in permeability of these blood vessels. And it starts usually with an innate immune response, which recognizes that there is some tissue injury, there's some trauma, there's an infection, there's some invading microbes, and that re recognition of offending stimuli leads to the activation of inflammatory signaling pathways, which have a vascular response, and that usually is resulting in vascular vasodilation and vascular permeability that allows inflammatory markers and mediators to migrate to the site of injury and carry out their job. And once you have that inflammatory response happening and the offending stimuli has been taken care of, and the tissue and the cells at the site of the injury um, have been repaired or removed, then you have a resolution of that inflammatory response where certain proteins come in and act as a calming agent to kind of calm the system down and say, yeah, you've done your job. Now you're ready to proceed and live life normally. However, when you do not have a proper resolution or resolution started and it failed, or there was no resolution of an inflammatory response, then you have what is known as chronic inflammation. As I mentioned, there are multiple players in the inflammatory response, and these are very specific depending on the offending stimuli, but they can generally be categorized into the four main groups that I have listed on this slide. We've got mast cells that are known for releasing histamines, and histamines are well known for their vasodilation and vascular permeability activity, which allows immune cells to migrate to the site of the injury or inflammation. Macrophages, on the other side, are activated monocytes that secrete inflammatory cytokines. And these cytokines can cause a local effect of vascular response, and they can also have a systemic effect involved in tissue repair through the increased activity of fibroblasts and collagen synthesis. Complement proteins are very important when you have an infection or of a pathogen or a parasite. And what these complement proteins tend to do is cause lysis of the invading pathogens, or they will coat those pathogens with biomarkers that allow phagocytes to be recruited to those proteins or those pathogens and lead to their destruction. So it's very essential to have pretty much all your parts functioning just right. And the last component that I have here is the arachidonic acid metabolites, which include things like granulocytes and prostaglandins, and they are released from mast cells as well as endothelial cells, and they lead to vascular permeability and an enhanced inflammatory response as well. The immune system is essential to the inflammatory response, as you can see from this slide here, where innate immunity is the starting point of an inflammatory response. And many of the cells and the mediators that play a significant role in inflammation come from the immune system. So having a working immune system is essential to fighting off invading pathogens, offending stimuli, and things that will generally cause your body to have an inflammatory response. So the main point of this webinar is to discuss this inflammatory response in conjunction with allergies. And so, yeah, just some information about allergies. This is a phenomena that can affect anyone regardless of age, gender, race, socioeconomic status. And the term allergy was coined in 1906 by this Mr. Clemens von Piquet. And it's used to describe the unusual propensity of an individual to develop hypersensitive reactions when exposed to certain substances. And generally, the substances to the rest of the population are considered non-toxic, innocuous, having no significant side effects. So things like peanuts and pet dander and certain plants and drugs, even herbal supplements, in some cases can elicit an allergic reaction from a specific person. It's considered one of the most chronic health conditions according to the WHO, since it affects about 10 to 30% of the world's population. And so this is a significant phenomena, especially knowing that allergic reactions cause an inflammatory response, and an inflammatory response that is not resolved can cause a chronic disease. So it's essential to understand the role of inflammation and allergies in day-to-day functioning and how best to deal with it. Allergic reactions can range from mild to severe, and in some cases can be life-threatening. And I've listed a few symptoms of allergic reactions below. This is not an all-encompassing list. So if you have an allergy to a specific substance or stimuli, it is best to know what possible symptoms can occur from those allergies, and hopefully have a conversation with your healthcare practitioner before you undergo this reaction so that you know what to expect and how to deal with it. The process of inflammation in allergies is pretty straightforward, similar to the more complicated slide that I showed earlier. An allergen is just an offending substance that the body recognizes as an invader. So it's going to have an immune response in terms of a T cell or B cell release of cytokines or IgE antibodies, respectively. In response to an allergen like a peanut, the body will produce excessive amounts of IgE, and then you have mast cell destabilization, the release of inflammatory mediators like histamines, and then a downstream allergic reaction. And it essentially is initiating this cascade of molecular effects that could affect the respiratory tract in cases of allergic rhinitis and asthma. It could affect the skin, so where you have dermatitis, and it could have a multi-system effect where you have anaphylaxis. there is really no single cell or mediator that can account for all of the features of an allergic reaction. And so it's hard to put on a slide what an allergic reaction signaling pathway is going to look like, just because of the complexity of this process. However, it is wise to understand that the allergic reaction is an inappropriate reaction. And so inflammation that is generally a defense mechanism is now acting in more of a harmful rather than protective role. So once you identify your allergy or an allergen that you could potentially be reacting to, it's wise to avoid exposure to that allergen if possible. Talk to your friends and family and coworkers and make sure that they're aware that you have this specific allergy, and can be helpful in helping to limit your exposure to that allergen. You should be seeking medical care, talking to your healthcare practitioner whenever you get a chance about your exposure to an allergen or possible allergens, and preferably carrying medications to treat an anaphylactic reaction that's caused by allergies. As I've noted on this slide, chronic exposure to those allergens will lead to chronic inflammatory response, and it is essential to note that a chronic inflammatory response is not a defense mechanism anymore. It is now something that has to be dealt with, or else you end up with long-term downstream effects. So on this slide, I've listed some of the causes of acute inflammatory responses. And on the other side, you have what the effects of chronic inflammation can do. So cardiovascular diseases, pulmonary diseases, neurological and neurodegenerative diseases, autoimmune diseases, cancer, lupus, chronic fatigue syndrome. These are some of the things that are caused by underlying chronic inflammation, which is low grade and sometimes does not show any symptoms before you progress to this disease state. So it's essential to be aware of your allergies and how you can prevent chronic inflammation by dealing with or reducing your exposure to those allergies. So we've talked about the immune system and a general overview of the inflammatory response and allergies. But one of the things that I'm very excited to talk about is the role of the microbiome in allergic reactions. It should be noted that the microbiome does play a role in many health conditions, and its role in disease states cannot be overstated. The microbiome is defined as the live microorganisms that live on or inside of another organism. So these are microbes that are present on our skin, in our gut, in our oral cavity, in our lungs, and they can be symbiotic, meaning that they offer a health benefit, or they could be pathogenic, meaning that they are going to cause you some serious harm. In humans, most of the microorganisms tend to inhabit the gut, but the skin, the gastrointestinal system or gastrointestinal tract, which includes the oral cavity, the vaginal canal, and lungs are also very well inhabited as well. And the composition of the human microbiome is very diverse, and that diversity is essential for in the context of health and disease states. So we should be aware that the microbiome does play a significant role in our health and in inflammation. There is mounting evidence to suggest that early life exposure through our mothers through our environment is critical for the microbiome, and dysbiosis of the microbiome is a heavy influential factor in immune system development and the possible development of tolerant responses to antigens in the future. So the microbiome has definitely shown itself as a key player in immune reactions and allergic reactions as well. And so dysbiosis is just um, an imbalance in the good versus bad bacteria that occupy our microbiome. So use of antibiotics can shift our our microbiome more to pathogenic strains rather than helpful strains. So it's very essential that we are aware of the role of the microbiome in our health and in inflammation and in the development of allergic reactions. Again, we'll just go a little bit quickly over how to handle allergic reactions. As discussed earlier, ensuring controlled exposures to allergens that cannot be easily avoided is essential. So if you know that you're allergic to peanuts, you don't eat peanuts, you stay away from peanuts, but you go into a factory on a tour and you get some exposure to some peanut dust and now you're stuck. So ensuring that you also have your EpiPen or something to treat your allergic reactions on hand in case you can't get to a medical practitioner is essential. There is a lot of evidence that shows that stress is a big player in allergic reaction development and inflammatory responses. So understanding the role that stress plays is essential to your health, and dealing with stress in a proper manner, talking to your healthcare practitioner about how to handle your stress, removing yourself from stressful situations is always a good option. Changing your diet and incorporating natural health supplements. There's a lot of foods in our pantries and on the grocery store shelves that tend to have pro-inflammatory actions. So processed foods and sugars, animal proteins that are animal meats that are rich in saturated fats. These are some of the things that promote inflammation. And that promotion of inflammation on a constant basis can cause an overstimulation of your immune system, and that overstimulation of the immune system makes it easy for allergic reactions to occur. And finally, never ever forget to consult your healthcare practitioner when you are making any significant changes to your diet, to your supplemental regimen, in terms of stress, in terms of just dealing with your allergies. Your healthcare practitioners can be your best friends at this point. Always be honest when talking to them. You don't want to leave out anything. If you're taking a supplement and you're talking to your healthcare practitioner, be sure to honestly list the supplements and medications that you're taking to ensure that contraindications are in the back of your healthcare practitioner's minds when they're prescribing you new supplements, new medication, or changes in your diet. So the next thing I'm going to go into, I'm going to discuss some of Aor supplements that can be useful for handling inflammation, especially when it comes to allergic inflammation. Now, as Dr. Herkel mentioned, the information that is provided here should not be taken as gospel. It is my opinion, and I'm not trying to sell Aor supplements. I am just giving you information based on the available research for these supplements and their roles in inflammation and allergies. So the first supplement I have here is quercetin. Quercetin is a flavonoid that is found in many plants, fruits, and vegetables, including grapes and berries and citrus fruits and buckwheat and broccoli. So if you are eating your fruits and vegetables in the recommended daily amounts and quantities, or even going slightly above that, you might be getting a nice healthy dose of quercetin, as well as other flavonoids and other polyphenols and other ingredients that are helpful for your health. Quercetin has been studied for its role in inflammation and immunity. It has been found to inhibit the production of cyclooxygenases and lipooxygenase. And this is essential because these two enzymes play a significant role in the inflammatory cascade. It blocks pro-inflammatory IL-6 secretion from mast cells and blocks the release of histamines as well. And it has been studied for its ability to prevent symptoms of allergies, including itchy eyes, itchy throats, sneezing, and nasal congestion. Quercetin is being marketed as a antioxidant. So this has great antioxidant capability. And this is important because reactive oxygen species have been shown to promote the gene expression of certain pro-inflammatory genes. So now in quercetin, you've got an antioxidant that can inhibit the expression of these pro-inflammatory genes. You've got an anti-inflammatory that can inhibit an inflammatory response, especially when it is not necessary. And you've got an agent that can reduce the symptoms of an allergic reaction. So you're basically killing 3 birds with 1 quercetin. So the clinical doses for quercetin are about 1,000 milligrams a day, usually broken up into 2 doses per day. And Aor's quercetin is 500 milligram capsule twice daily. A new product that has been on the market by Aor for the past few months is PEA Activate. This is a very exciting product. It contains a very well-studied compound, palmitoyl ethanolamide, and this is one molecule that you can't speak enough about. It has been studied for over 80 years. It's an endogenous cannabinoid-like molecule, and it's believed to have an effect on the endocannabinoid system. It has been widely studied for its role in pain and inflammation, and it's been marketed for chronic pain and inflammation. This molecule is produced by the body, so it's endogenously produced, so our bodies do know what to do with it. And it can also be found in many food sources, including milk, eggs, peanuts, and many more. PEA has been studied for its anti-allergic effects. And this studies started in the 1950s, where children with rheumatic fever were found to get better when they were giving daily supplementation of egg yolk. And once the isolation of the compounds in the egg yolk were done, they were similar to a molecule that had been isolated previously from peanuts, and characterization confirmed that this molecule was PEA. It has numerous targets, and I've listed some of the targets on this slide here. These targets are specific to its anti-inflammatory action, but it does have further action on different targets as well. It's been shown to reduce mast cell migration and degranulation. So this helps inhibit the release of histamines from the mast cells. It also reduces the activity of cyclooxygenase enzymes, and it decreases pro-inflammatory cytokines. So this molecule, small but mighty, it is able to help your system get back to normal. It's able to allow your system deal with inflammatory substances in an appropriate manner and then get back to normal. So again, there is a lot of information on PEA and I couldn't fit it in this one slide, and because we're on a time limit here, I have linked the Truth magazine about palmitoyl ethanolamide to this slide, and it is available for anyone that wants to read it. It covers a wide range of topics on the benefits of PEA and how best to make use of this molecule and take advantage of its role in the endocannabinoid system for our health and our well-being. The next product I'm going to talk about is Aor's Advanced Allergy Relief. As the name says, this is a product that is specific for allergic reactions. So it's used in relieving seasonal allergy symptoms, and it has been shown to promote, the ingredients in this product have been shown to promote a healthy immune system. It contains probiotics, botanicals, vitamins, and minerals. And this is important because a lot of research has shown that diets that are rich in certain vitamins are useful for reducing immune imbalances and helping with an allergic response. Other vitamins are essential immune modulators and can be useful against allergies. This formulation contains urtica, tinospora, and perilla, and these are widely used for their anti-inflammatory and antihistamine effects. And tinospora specifically has been shown to move immune responses away from that excessive IgE mediated allergic reaction. This product contains a well-studied probiotic, Bifidobacteria BB536, and this probiotic has been studied for its role in promoting a balanced intestinal microflora and helping to modulate the immune system. And as we talked about on the microbiome slide, the microbiome and its diversity and its role in immunity is essential for the development of tolerances to various allergens and stimuli. So having a proper balance of vitamins and minerals for immunomodulation, anti-inflammatory agents, antihistamine agents, and a healthy digestive tract promoting ingredient, it makes for a one comprehensive formula that can be used as a prophylactic agent prior to exposure of an allergen. So this is going to pretty much reduce the chances of an allergic reaction occurring when there is an exposure to an allergen, especially in an uncontrolled situation. And because we've talked about the microbiome and we've talked about the diversity of the microbiome and the role of the microbiome in immunity and the development of tolerances to allergic reactions, Aor does have a whole host of probiotic and prebiotic formulas that help promote a healthy and diverse microbiome. Antibiotics were introduced in the early 50s, and the use of these antibiotics have been associated with an increase in the incidence of allergies. And as I mentioned earlier, antibiotics are notorious for inducing dysbiosis, so they tend to kill off some of our healthy bacteria, allowing more pathogenic strains to invade our microbiome and cause downstream health effects. So Antibiotic use is very prevalent, and a lot of doctors are now happy to prescribe antibiotics when you show up at the hospital or the clinic with an infection. And so once antibiotic use is done, it is usually recommended to start a round of probiotics so that you can repopulate your microbiome with healthy bacteria so that you retain that health benefit. AOR has a few prebiotics. We've got Solufiber, which is partially hydrolyzed guar gum that has um, been shown to promote a healthy microbiome population. We've got Advanced Biotics, Breath Biotics with Bliss K12 and Probiotic 3 with three very well studied strains of probiotics. It's got Clostridium in there, Clostridium butyricum, which is well known to increase the production of short chain fatty acids and act as a prebiotic. It's got Enterococcus faecalis, which has been shown to suppress Th17 immunity and the symptoms of allergic airway disease, and has been looked at as a potential therapeutic agent for allergic reactions that have to do with the respiratory tract. And Bliss K12 is present in both Lavarox and Breath Biotics, and this is also a well-studied strain that has been shown to populate the oral cavity and provide its health benefits that way. So if you're looking for something to balance out your microbiome, improve diversity, and promote your health, as well as stimulate your immune system, our line of probiotics is one way to go. So that being said, I have come to the end of my presentation. All of the references that were used to put together the information in this presentation can be found here. And I will like to thank you for your time today, and I'm more than happy to answer any questions you may have.
Great. Thank you so much, Dr. Pamela. That was a really great overview. I think you definitely summarized some of the key formulations that are associated with Aor's allergic and inflammatory product line. And as you mentioned, quercetin is something that is a huge buzz right now as it relates to the antiviral effects of
Exactly.
quercetin.
Yeah.
Is there anything that you can share in terms of what makes quercetin such a good option for allergies, but as well as an immune modulator? Does it have that many actions?
Yeah, so as I mentioned, so quercetin is an antioxidant, and there's a lot of research that is now pointing to the role of oxidative stress and reactive oxygen species in the promotion of inflammatory responses. So there is that one link right there where now once you're inhibiting the ROS production, you're preventing that pro-inflammatory gene expression and the downstream signaling that happens from there. And then you also have the added benefits of separate anti-inflammatory effects by directly targeting COX and LOX and TNF alpha and NF kappa B. These are very well known pro-inflammatory cytokines and proteins that tend to be released and activated following exposure to an inflammatory substance or an allergic substance. So yeah.
So obviously there's a lot of overlapping actions between reducing allergy, but also remember it works on the immune system, which is the key player in obviously combating any sort of infection, but specific viral infections.
Exactly. And it has been shown to actively target mast cells.
Right.
So prevent mast cell destabilization. So you have these targets, but you also have, in the event that an allergic reaction does happen, and or the signaling cascade has started and the mast cells are starting to get destabilized, quercetin can also help in that area.
Um, One question is can you take the products you mentioned in combination? Because there's some clear overlap
Hmm.
between advanced allergy relief. It doesn't
Hmm.
contain quercetin, but obviously quercetin, you talked about a lot of the benefits. And then
Hmm.
with the addition of PEA, could you take all three of these together?
So the one thing that I would advise is that you always read the product label. The cautions on the product label will give you a very clear indication on whether or not you can combine supplements. And again, talk to your healthcare practitioner before you start combining supplements. However, for the three products that you're asking of, um, combining them will not, I'm not going to say will not. It may not cause any adverse effects. It's These are very person-specific ingredients, and they will work with your body to get the benefits. The one thing that I will say is, if you want to combine, two or three supplements and there is no specific cautions on the product label asking you not to, maybe take them a few hours apart to give your body the best chance
Yeah.
of utilizing each ingredient to the best of its ability.
Yeah, that's a good suggestion. And even you could break it apart with different meals, right? If you took
Exactly.
quercetin.
Yeah.
My understanding is that quercetin is best absorbed when taken kind of before food. That's always the
Hmm.
way that I've suggested with my patients.
Yep.
And so again, because it is a bit of a bulkier molecule, the absorption, the research shows the bioavailability sometimes can be a little bit affected.
Yeah.
And of course, Aor's quercetin is citrus free, which does give it like an additional selling feature because citrus is an allergen for some people.
Exactly. Yeah. So you
Okay,
don't want to
a
take some
question
quercetin and then have an allergic reaction. Oh.
that would not be very helpful. Can you talk a little bit about the advanced allergy relief in terms of whether it could be helpful for either treatment or prevention? What does the research say?
Um, Advanced allergy relief, as a nutraceutical company making natural health products, the regulations do say that we cannot treat or prevent. However, the research does s- point to more of a prophylactic effect of the ingredients in advanced allergy relief. So you're looking at a probiotic that is going to help populate your microbiome, your gastrointestinal system. And so that helps with immune stimulation and immune modulation. And you're looking at vitamins and minerals that help promote health. So these are all things that are working before you are exposed to that allergen, so that when that exposure does happen, um, you are ready to fight it, you're ready to deal with it. If the exposure does happen before you take the advanced allergy relief, you're not getting nothing. You still have these ingredients in there that will help you fight off that inflammation as well, because there is the ingredients in there. You've got the vitamins and the minerals that help reduce that inflammatory response that has already started. You have you have ingredients in there that will inhibit mast cell destabilization and the release of histamine. So it is best taken as a prophylactic, but if you do have an allergic reaction, it can still be very beneficial.
Yeah, that's an excellent point. I think a couple questions are actually in surrounding this. How long should a person take it to be prophylactic? I mean, I just took
Mhm.
a quick peek at the research while you were chatting there, and one of my favorite herbs in advanced allergy relief is the Tinospora,
Mhm.
which is the first product that Aor has actually launched with this herb. And when I went through this as we were creating our educational material, like the research on it is very impressive. There's quite a bit of human clinical evidence behind it. And there's a couple specifically when it comes to like sneezing, nasal obstruction, nasal discharge, itchiness, swelling your nose. It showed that there was an improvement after 15 to 30 days, both groups with the Tinospora. So that hopefully should answer the questions about how long a person should take it before. I think at least 2 weeks, maybe before the allergy season. It takes a while for zinc to be incorporated, right? So that's something.
So I would say 2 weeks to a month before allergy season starts to pop up, and then you can still take it throughout the allergy season just so that you reduce the symptoms that could occur when exposed to those allergens.
And also PEA, because it's a fatty acid amide, it needs to be incorporated in the cellular membrane as well, right? It takes a while. So the research again on PEA is a bit more of a longer term piece. Like there are some
PEA is definitely a longer term use. It is used for more chronic conditions. So chronic inflammation is going to be something that you want to have PEA as your defense right there.
And my clinical experience shows that it takes about a month to notice a difference in chronic pain, and allergies would be the same timeline. So, I mean, if people are trying to kind of break it down in their minds, you know, advanced allergy relief and PEA could be used preventatively, kind of 2 weeks to 4 weeks before allergy season. Get your levels up in the cellular membranes of PEA, and then I probably would look at quercetin as a bit more of a, okay, if I'm having a response, it can stabilize mast cells a little bit more acutely. You can definitely add in quercetin. And then, you know, this is something that obviously is not, you know, is my opinion, but, you know, you can definitely dose up with quercetin, you know, to find what works for you. So I've personally had experience with people using, you know, 2 capsules 3 times a day. That's not the Health Canada approved dose, but just my clinical opinion that sometimes help. But I would say slowly increase that over a period of a couple days, and people can have very acute, very effective allergy relief results.
Definitely. I think you've broken it down perfectly, especially if people want to take multiple products, to have that prophylactic use first to help you prepare for the allergy season. And then if you do get an allergic reaction and you're in the throes, you can definitely use quercetin to help reduce those symptoms as well.
Yeah. One final question here. Can you apply this to other allergies like food allergies? So we were talking a lot about seasonal allergies here, which I know majority of the research is there, but any of these 3 formulations, in your opinion, would be applicable to a more of a food IgG, IgA type of reaction rather than an IgE?
That's a good question. I think PEA and our line of probiotics are a good option for someone with food allergies. The probiotics and prebiotics are good because they improve your immune system and your microbiome, helping you fight off that inflammatory and immune response that you're going to be getting with a food sensitivity. Advanced allergy relief is probably not going to do much good for you there.
Well, I think theoretically, you know, I think there's application. I would say with the ingredients that we mentioned, you know, most of the research is on seasonal allergies. I think you hit it correctly with PEA, because PEA has the additional benefit of stabilizing some of the tight junctions in the gut lining, which is a huge factor when it comes to food sensitivity. So PEA for sure. Zinc has lots of research on healing kind of intestinal permeability, which is found in advanced allergy relief. And I would absolutely kind of assume that the mechanisms of action of both quercetin and Tinospora and the other ingredients like perilla in the advanced allergy relief would apply. But you're right with the probiotics, because you know, I just was traveling, doing some teaching out in the East Coast, and you know, a person came up to me after the presentation, said the probiotic 3 that you have, because it regulates Treg cells, which are the
Mhm.
important kind of inflammatory regulators of inflammation. She found that her inflammation went down, and specifically her food allergy related
Mhm.
symptoms. So she was able to tolerate foods as long as she was on the probiotic, which is an interesting case report
Yeah.
anecdotally, but there's, again, I think the mechanisms of action are there.
Yeah, like you said, theoretically, those mechanisms of actions are there, and it would be interesting to collate all of that data anecdotally to see what is happening from a clinical perspective, and maybe make additional recommendations for the supplements. And these are just a few of the supplements that I was able to put together for this presentation, but we have a whole host of other supplements that can be beneficial from a food sensitivity or food allergy point of view as well.
Yeah, for sure. And that would be a great topic for another time.
Hmm.
Those are all the questions that everyone has. Those are some great questions. Thank you so much for sharing those with you. Dr. Pamela, thank you so much for your excellent presentation. I know that I found that it was really helpful just to get an overview of the immune system, the allergy system, and also the products that you highlighted, and excellent responses there on the Q&A. If anyone has any additional questions, they can email them to marketing@aor.ca. Again, that's marketing@aor.ca. Don't forget to sign up for our next webinar that's coming up next month, April 14th. Again, same time, same place, 12 p.m. Eastern time. Chantal Dumas, our medical advisor, naturopath from Quebec, whole host of experience, especially when it comes to gut health, neurodevelopmental issues, and
Okay.
any sort of women's health. Optimizing your digestive health and building a healthy gut. If you're not registered, please go to aor.ca/B2B-webinars. Thank you so much for attending, and hopefully everybody has a wonderful afternoon.
Thank you.